The Museum of Teaching and Learning welcomes you to another episode of our series, Teaching in Times of COVID, stories dedicated to the experience of educators in public, private, and home teaching settings. I'm Denise Steedman, your host. Today, we're joined by Christie, who is a district school nurse in Madera School District.
Hi.
Christie, welcome.
Thank you.
Christie, let me ask you why you became a school nurse. Was that your first career choice?
So, I decided that I wanted to be a nurse when I was 15. I was volunteering at a local children's hospital and loved the role of a nurse, to be able to walk with people through some of the hardest times in their lives, to support them and to be there for them. So at 15, I decided I wanted to be a nurse. I knew I wanted to work with children when I entered college, but it wasn't until my last semester of nursing school, when I had my senior project, I dabbled in school nursing, and I absolutely fell in love. I loved the public health aspect of the nursing. It was more health promotion rather than treating illness. And unfortunately, at that time, as I was graduating, California was going through massive budget cuts. School nurses were getting cut right and left, and there weren't any school nurse positions available when I graduated from college. So I went and I started working at the same children's hospital where I volunteered as a high schooler. And I spent 11 years doing bedside nursing. I bounced between the neonatal intensive care, I did acute care, I did med surg, I did pediatric intensive care, I worked in the OR briefly, but it was always in pediatrics. I never wanted to work with adults. I always wanted to work with the kids. But then as the years went on and got married, I had kids, and it got to the point where I wanted to be on the same schedule as my kids. Didn't want to be a zombie mommy and working nights, and I didn't want to miss holidays and weekends. And so we kind of came back to the idea of school nursing that would allow me to be on the same schedule as my kids, to be present. And so it just so happened that at that point in time, our local school district was doing a massive hiring, and I was one of 10 nurses that were hired on the district that year. And I, again, fell in love with school nursing. The opportunity to build long-term relationships with the kids and their families, to support them through the highs and the lows, and to really advocate for them and to educate and equip them to make healthcare decisions for their kids was so rewarding, and I loved it. And so I've been doing that I just finished my 3rd year of school nursing.
Christie, we may think that we know what a school nurse does, but my guess is that we don't really know. Can you tell us what the many responsibilities you have?
The campus mom is a good, I guess, description. So as a school nurse, when I'm trying to describe my role, is I, as the nurse, am here to promote the health and safety of my students, of my staff, and I'm here to help children overcome any physical or mental barriers even that would impede their learning. So that can mean I am working closely with our special education students. I am doing assessments, working with their parents, connecting them with resources, or, just basic education, helping them understand some of the special needs that the kids may have. As far as the general student population, obviously doing the day-to-day healthcare needs, whether it's giving medications, assessing for injuries or illness. We do a lot of training with our staff. If we have students with special health needs, we will be training our staff to make sure that those students' needs are being met in the school setting, and to make sure it's a safe environment for them to learn. And then we also do a lot of infection prevention measures. We monitor illness trends within the school. We make sure we're communicating with the health department if we notice any outbreaks. Also, as a school nurse, I feel like we do a lot of social work. We connect families with resources within the community. We are very involved when it comes just helping them overcome barriers to access health care. A lot of our lower socioeconomic families, something as simple as going to the doctor and getting a pair of glasses is a huge hurdle for them to overcome sometimes. And so sometimes, it's knowing which doctors take which insurance, or this clinic's going on, or even if you're in a big school district, you have a lot of resources and they have like vision vans. And so it's coordinating those kind of outreach things. And then I feel like more and more we're getting pulled into that mental health realm as well as school nurses. Especially this past year, we have been finding ourselves being the nurse and social worker, and also helping step in with the mental health professionals as well, and supporting our kids and their families through kind of a really difficult season.
Speaking of the difficult season, can you recall that Friday the 13th in March of 2020, how did that day roll out? What kind of information did you have? Did you know that something was up? And then how did that day proceed?
So when I think back to Friday the 13th, that was a slow train wreck. We knew it was coming. As a school nurse, as a nurse, we were receiving frequent updates from the health department. I remember even back in February being aware of COVID's presence. Not yet in our school district, but we knew it was coming. It was a matter of time. And even at that time, I remember talking with my husband and making plans and deciding not to go to an annual event that we usually go to as a family, because I knew that there would be a lot of international travels at that event. And I told him, I think this year we just need to sit this out just until this blows over. Like, there's something coming for us. It's on the horizon. We just don't know when it's going to hit yet. And so leading up to the 13th, you could just feel the tension growing. The teachers were getting more antsy. Every kid, of course, when you're talking about flu and cold season is usually like fall, early winter, and then the flu season hits. And so we had just this massive flu season that year. And so I spent most of the end of February, early March dealing with a flu outbreak on one of my school campuses. Teachers were, on high alert because of the flu, and they would have tons of kids out in their classroom. And I was seeing like 20, 30 kids in one school campus come through my office a day. And so everyone was already on edge. Teachers were already, every little sniffle, cough, everything, go to the nurse. And so the teachers were asking more questions about COVID. And at that time, we just didn't have a ton of information to give them. All we could tell them is it hasn't hit yet. You will know when it hits the district. We will let you know it has not hit yet. And the parents were getting antsy. We had parents pulling their kids out of school even before the school closures, and saying, hey, we're just going to hunker down at home, or we're going to wait for this to blow over. So we knew a shutdown was likely coming. We knew we were going to have to close schools. We just didn't know when. And so when the 13th hit, I was working in my office, and my office was just off the main school office. And I had a window out to the courtyard area where they did student pickup, and sitting in my office working, cleaning up for the end of the day. And I started noticing there was just a ton of activity out in the courtyard. And there was a lot of talking, and someone, I can't remember if they called me or they came into the office and talked to me and asked about the school shutting. And I said, no, I haven't heard anything. What's going on? And so they were like, no, the school's shutting down. The school's shutting down. I said, we haven't heard anything. Nothing official has come out yet. And apparently there was a news leak. And the word got out before the superintendent had a chance to make a formal announcement. So I'm sitting in my office trying to get work done, finish up for the week. And the vice principal came into my office and shut the door and said, it hasn't been officially announced, but they are shutting the schools. There will be an official announcement at 3:00. And school was out at 2:05. So it was madness. The phones were ringing off the hook. There were tons of people coming in and out of the office. And I remember sitting in my little office watching just everything go down. And an image that will forever stay with me was one of our students. And like I said, I'm kind of the school mom. And so I'm not supposed to have my favorite students, but there were just some students that I just looked over a little bit closer. And one of my babies was standing in the middle of the office, looking so lost and so confused, and just standing there silently with these big eyes, just watching everything going on around them. And I remember sitting there watching that student and thinking about what's going to happen to these kids, what's going to happen to my babies. And so got everyone out, got everyone picked up, and got her home. And then they pulled us all into a meeting room at 3:00, listened to the superintendent's announcement that we were closing schools. At that point, it was just supposed to be a week or two. And I kind of stood around, and at that point, I hadn't even had any official announcements from my managers from health services. So teachers were turning to me and asking me questions. I don't know. This is a quickly, rapidly evolving situation. So we knew it was coming. We just didn't know when it would hit or to what extent.
So it's interesting that you feel that you didn't know in advance, since you're a little bit of a liaison between the county health officials and all. So do you think that the state came out in front of this?
So at the time, I was working with one of the largest school districts in the state. And I really feel like all the school districts were watching those big school districts and just waiting to see who's going to make the first move. Gavin Newsom hadn't made an announcement yet. So as the day was progressing, it was like, oh, Los Angeles closed. Oh, San Diego. Oh, and so then everyone started looking at our district. and was like, oh, when are you going to make a move? And so I feel like once the big school districts all decided, like, nope, that's it, we're shutting the doors, then everyone was like, okay, we're doing the same thing. So it was kind of who's going to make the first move, at least from a nurse perspective, watching
Right.
it all go down.
Right. And with that, if they do it, it gives the school district a way of saying, this is statewide.
Yes.
And we are part of that as they start
Yeah,
shutting
no
down.
no one's acting rogue right now. We're all
Right.
kind of in unison going, nope, this is how we're
Yes.
proceeding.
And you mentioned several times, you used the word blow over. Universally, everyone thought 2 weeks,
Oh, yeah.
3 weeks, a
We're,
month.
we're just going to hunker down and
Right.
it'll blow over and we'll be fine.
Yes, and school districts were really hit with that because
Yes.
you have to do with parents. How were the parents notified? Do you know how that happened?
So, like I said, the news agency had leaked the story prior to the official announcement. So there was an official press conference that the superintendent got up and announced, and then it was just massive emails and robocalls out to all the parents to kind of let them know what was going on.
So did you experience a lot of phone calls from the parents of, say, students that you had to give special attention to for medications or?
Yes and no. I think because everyone thought it was going to be so brief. We were so close to our spring break anyway, so I think everyone was like, oh, it's just going to be a spring break early. And so everyone kind of rolled with it and didn't really think much of it, but it wasn't until like it kept getting extended. And then it was like, well, maybe I should start buttoning up things for the year and get medications back to kids. And so it was, yeah, we didn't know what to expect when it first hit.
Who makes those decisions? Does that come from you? You're the district school nurse, or does the health department or the superintendent help you with that?
So those decisions were made in conjunction with the health department and the district I was in. It was, we had an entire health services team. So there was a lot of talk with the school board. There was talk with the director of health services. There was direct talk with the county health department. So it was very much a big team decision. I mean, ultimately, it was the school district's decision, but it was very much a team effort.
So when did you figure out, now I have to go online? You're not going on campus, you're not seeing parents, you're not meeting with other team members for evaluations and such. How did you move your job online?
So I would say the end of the 2019 school year, no one knew quite what to do. We kind of buttoned things up early and said, well, we'll see what happens in the fall. We were waiting to see, what are we going to do? What's the plan all summer? What's the plan? What's the plan? And unfortunately, they didn't come out with a plan until like a week before school started. So then we kind of had to pivot and, okay, so what does the role of a school nurse look like in a distance learning environment? All of our special education assessments that were supposed to happen the spring before had gotten pushed. And so now we're trying to figure out, okay, well, how do you complete a health assessment on a student while following COVID precautions? We had to figure out how do you support your families, make sure they're getting the appropriate resources when doctors' offices are closed, when they can't get in to go have vision exams, or they're not getting their therapies. How do we make sure, with everything that shut down, life still went on, and our kids still had needs. How do we meet those needs, and what are the priorities? What can we kind of wait on? What do we have to act now on? We switched very rapidly from an in-person assessment to we were calling people, we were texting people, we were emailing people, Skype, video. Like, we got really electronic savvy. And we learned a lot when it came to reaching our families, because unfortunately, parents still needed to work. Parents still needed to put food on the table. And so how do you support them? How do you reach them if you don't physically have their child in space?
Mm-hmm.
So it was a steep learning curve.
Let me ask you about a special group of students, and those are incoming kindergarten students. How was that? Was it difficult? How did you handle that as it approached the fall, now that you've gone through the whole summer and young children should normally start kindergarten?
Yes.
How did that work?
So you get creative. A big part of an incoming kindergartner is vaccinations, trying to make sure all of our kiddos were vaccinated was a challenge. Because like I said, doctors' offices were closed. Parents were telling me, how am I supposed to get my child in to get vaccinated if they haven't had their well child visits? If they can't get their vaccines, how are we supposed to do this? And so it really took a lot of effort to start working with other community partners to try to get all of our kiddos vaccinated, to get their well child visits done, to get all the resources they needed. It took a lot of just thinking outside the box and trying to figure out how are we going to make this work.
And was that successful? Did you have parents that could do that? Because is there not a vaccination mandate, or explain that to us? How does that work for kindergarten children?
So California has some of the most stringent vaccination requirements when it comes to school. As the years have gone on, it's gotten tighter and tighter for families, and as school nurses, there's a lot less wiggle room. So we were kind of hoping California would make an exception if we weren't in person, that we wouldn't have to mandate the vaccines. But California said, no, we still need to make sure our kids are vaccinated. We still need to meet those requirements. And so it was hard for parents. I can't count the number of times I said, well, my kid's not even physically in school. Ordinarily, if you have a child physically in school, you can say, well, I'm sorry, your child's not fully vaccinated. They can't come to school. Well, if they're logging on online, there's no teeth in that. So unless you can figure out how to restrict their online access, you wouldn't really have much of an ability to regulate that. It wasn't until they started opening schools back up to cohorts or, to part-time instruction, then we really had some teeth. Then we were able to say, okay, if you want your child to come back to school, we need to get them vaccinated. So it was a continuous process of trying to work with parents and being like, I understand it's difficult. Let me try to find you resources to help you and to get everyone on the same page.
Were they a little bit more receptive because the hybrid school in classroom may have come up, so they understood better, okay, now my child is going to go to class 2 days a week. So yes, I understand. I have to get
There
that
was
done.
definitely more motivation. They wanted their child to have that opportunity to be in class, to be in space. And so there was definitely more motivation. And at that time, too, I feel like there were more resources available because at the beginning of the school year, like I said, we didn't know exactly what we were supposed to do. And so with the COVID precautions, you know, is it a higher risk for a healthy child to go see the doctor and get vaccines? Or, you know, should they just, or are they more at risk, you know, waiting? But as more information was available, as we started rolling through the school year, more options did make themselves available. So there were certain clinics that said, okay, you know, we will do vaccines. You can refer all your kids to us for vaccines. We won't do the well child visits, but we'll do vaccines. And so, you know, we just didn't have a lot of resources available to start off with. But as time went on, more things did open up, and we did have more.
Things came online
Yeah.
for you to refer to. You mentioned a little nod to social work. Let me ask you, and you can tell me if this is related. What is your role in regards to student evaluations? And are you, as a school nurse, part of a team?
Yes. So, education is very much a team effort. We all have our different, as professionals, have our different trainings, our different experiences and specialties. So very much so when it comes to an education, especially for a child that is struggling, it is a team effort. When we're talking about special education assessments, I am one member of a team that that often includes the school psychologist. It can include the special education teacher, the general education teacher. It includes oftentimes an administrator. We may have an occupational therapist or a physical therapist involved. If the child is deaf or hard of hearing, we will have a teacher who specialized in that. We also, if the child is connected with outside agencies, we invite the outside agencies to also be involved in that. So we all will assess the child within our kind of scope, but gosh, we all kind of intermingle sometimes. And so sometimes the line gets blurred where if I have a child who, say, is autistic, I'm going to work very closely with my school psychologist. If they're connected with outside resources, I might talk with their ABA therapist. I might ask to talk with their psychologist who made the diagnosis. So it's definitely a team, and the more people we have on the team and who can add clarity and give us a better idea of the full picture of what's going on with this child, the better it is. And the better we know kind of as a team what resources we need to offer and where we can head and help support this child.
What do you think will be the effect of the pandemic on special needs students and children with chronic health challenges going forward? Is that to be determined, or do you have some thoughts on that?
So overall, from what we're seeing, the children who had the best support systems going in are the ones who are faring the best. So if our kiddos had a really good support system around them, they had the therapies, the resources, good family support at home, whether, that's, or even just within a community, their resiliency level is much higher than a child who didn't have a really good support system around them. And so we're kind of seeing that gap widen. So some of our special education students who have therapists, psychologists, psychiatrists, They have, speech therapists. They have just all these resources available to them. Some of those resources might have been put on pause temporarily, but then have picked up again. And so those kids are actually doing pretty well. For the kids who didn't have all the supports in place prior, they're really struggling. And so we are seeing massive requests for new assessments for special education services. Children who were kind of borderline, kind of like, let's wait and see how they develop and grow, are now, families are like, no, we need help now. We need to be assessed. We need to get connected with resources now because that gap has just widened.
May I ask you about a new small group of students, trans and gender-neutral students? Because your school district includes high school
Yes.
students, correct?
So, like you said, this is new. We're all learning, we're all growing, and we're all adapting to best meet the needs of our kids. My foundational beliefs play a big part in how I serve these children. Foundationally, I believe that every child, every life is sacred and deserving of honor, respect, and love. And so that is my guiding principle when it comes to meeting these students' needs. So we have to sometimes adapt the practices that we've done for years to make sure that we are honoring, respecting, and showing them love. So something as simple as our scoliosis screenings for 8th graders. Typically in the past, what they would do is you had a boys' day and you had a girls' day, and you would line all the boys up and you would screen them and you'd be done. And then you'd do the girls. And so for those students who don't solidly fall into either of those categories, we have to think about their needs. We need to think about how can I honor and respect them and their needs and make sure that I'm meeting their health needs, but also their mental and their emotional needs too. So it's not always cut and dry. So sometimes, we do need to accommodate and we need to think outside the box, and we need to make sure that as healthcare professionals, our kids know that we're safe and they can come to us and we're going to help them meet their needs regardless of anything.
You and your husband have a very large family. I'd like to ask you to tell us how the pandemic hit you personally that time, as much as you would like to share with us. Can you talk about that a little bit?
So our story is really funny. So we have a large multicultural family. We've adopted multiple children. And it just so happened before March the 13th, we had found a piece of property that we loved that would give our family room to grow. And so we, literally the Sunday before everything shut down, and we had found our dream property, and we quickly got our house put together, put on the market, and I jokingly said, they're not allowed to close schools until this house is in escrow because my children will not survive being shut in this house while showing this house. And so 3 o'clock, superintendent made the announcement, we're closing the schools. At 3:20, we got an offer on our house and we said, we're taking it, we're gone. And so we moved our family on April 1st in the middle of a pandemic, in the middle of a shutdown, from an inner city to 12 acres out in the foothills in the middle of nowhere. And it was perfect because I could throw my kids outside and I could say, if you can't see the house, you've gone too far. And so that's how we survived the first several months.
So you've gone from downtown in the city to on the farm,
Yes,
or the ranch.
we now have a farm, so our children have learned to bottle feed cows and goats and kittens and puppies, and so
Well, that sounds wonderful, actually.
that's how we survived.
Christie, in this time we have left, I'd like to ask you one last question. Can you tell me, what are you most proud of?
The adaptability that I've had to learn this past year. There have been a lot of obstacles, a lot of questions of, I don't know how to do this, but hey, let's figure this out. It's uncomfortable having to learn to pivot on a moment's notice. No one likes it. It's not fun. We have bent to the almost breaking point, but we have not broken. And so that's one of my biggest pride, points of pride, is we have overcome a lot. We have learned and we have grown a lot. It hasn't been easy. It's been really hard. But we're not broken. So, I'd say that's my biggest.
Christie, thank you for your time today. Thank you for being with us.
All right, thank you.
Please visit our website, www.modal.org. That's MOTAL.org, to learn more about our exhibits, events, artifact collection, and more. Also, find us on Modal's YouTube channel, Facebook, and Instagram. Museum of Teaching and Learning. We educate people about education.
Teaching in the Times of COVID is brought to you by the Museum of Teaching and Learning and is the sole owner of its content.